Okay, so today we will discuss vascular tumors, right? We have already done heart tumors, and now today we will do vascular tumors, right? Okay, so again, as you know, whenever we are classifying neoplastic lesion or tumors, we classify into benign tumors and malignant tumors, right? And generally, it is not difficult to distinguish between a benign tumor and malignant tumor. And obviously, you have already, done your general pathology, in which general rules of classification and general features of benign tumors and malignant tumors. But here, in some areas of pathology, like in soft tissue tumors, bone tumors, and here again vascular tumors, because vascular tumors are also mesenchymal tumors, they are not epithelial tumors. So here there are basically three categories, not two categories. That is, there are benign tumors, and then there are intermediate malignant potential tumors. That is, those tumors generally do not metastasize, but they have a tendency to recur. If you remove it, the surgeon remove it, and if any margin is positive, or if it is closed, then it tends to recur. And very rarely they do metastasize as well, right? And then there is a malignant category. So remember that, like soft tissue and bone, vascular tumors are also mesenchymal tumors. So they have three categories of tumors: benign tumors, intermediate tumors, and malignant tumors. Obviously, it's a difficult concept to digest, that we are learning from the beginning that they are benign tumors and malignant tumors, and benign tumors do not convert into malignant tumors. This is true that benign tumors will not convert into malignant tumors. There is a separate category in between benign and malignant which are intermediate. And even benign and malignant tumors are sometimes difficult to distinguish on histology, especially in case of vascular tumors. So the general rule of thumb is that if uh, obvious vascular channels are being formed and each vascular channel is separate, that is, two vascular channels are not interconnected, and they are covered by only, they are lined by only single layer of endothelial cell, then it means that this a benign tumor, right? On the other hand, if the vascular channels are poorly formed, obviously the vascular tumor will form vascular channels or blood vessels. So if the blood vessels are poorly formed, number one, they are interconnected. One blood vessel merge into the other blood vessel or connected to the other blood vessel, right? Like to form a tree-like structure. Or the endothelial cells are more than single layer thickness, then it means that it is either intermediate malignant potential or potentially malignant tumor, right? Okay, so malignant tumors are more cellular, that is more endothelial cells. They have atypia, right? They have mitotic figures. They are invasive, that is, they are invading into the surrounding soft tissue. These are other features by which you can distinguish. Sometimes the tumor is so poorly differentiated that you cannot, you know, definitely tell that this is a vascular tumor. Then you need to do some markers, immunohistochemical markers. So I think you should remember one or two immunohistochemical markers, especially CD31 and CD34 and 1 milligram factor. At least CD31 and CD34, remember, these are vascular markers. So if these markers are positive, it means that it is a vascular tumor, right? And benign tumors are usually easily to distinguish. It is no need to do a vascular marker, immunohistochemical marker. But sometimes the malignant tumors are poorly differentiated, and you need to perform immunohistochemistry. Okay, so what is the classification? Number one is that apart from benign tumors, there are many vascular malformations as well, right? For example, AV malformation, you already well aware of it, in which malformation which consists of arteries and veins. Similarly, there are other vascular ectasia which we will study. So benign, first we will do benign tumors and vascular malformation. So hemangioma is the benign vascular tumor, and hemangioma can be capillary and cavernous, right? And capillary hemangioma is also called as pyogenic granuloma, right? Similarly, lymphangioma can be simple or capillary and cavernous. What is the difference between capillary and cavernous? You know, capillaries are small size of blood vessels, whereas cavernous are large, big vascular channels, right? Generally venous in origin, right? So capillary hemangioma and cavernous hemangioma. Then glomus tumor is basically a tumor of perivascular cell. It is not endothelial derived tumor. It is basically in nail beds. There are thermoregulators. These are modified smooth muscle cells, right? And these modified smooth muscle cells give rise to a tumor which is called as glomus tumor. It is particularly very painful, and it typically occurs in the nail bed. So, in fingers or nail beds, a vascular tumor, a tumor appears, then it is most likely, and it is specifically if it is painful, it is most likely a glomus tumor, right? Then we will do some vascular ectasia. Vascular ectasia means it is not a neoplastic lesion of the blood vessel. It's basically a dilated vessel, right? It is again a malformation in which the vessels are just dilated. Then in many conditions, you know, reactive vascular proliferation occurs. For example, if there is ulcer on the skin, what happens after some time? There is a reddish granulation which is formed. What is that? It is basically reactive vascular proliferation along with fibroblasts, which is called as granulation tissue, right? So benign vascular tumors, hemangioma, capillary cavernous, lymphangioma, capillary cavernous, then glomus tumor is a perivascular tumor, then vascular ectasia, then reactive vascular proliferation. Then, as I told you, there are intermediate grade tumors, that is, intermediate tumors which are in between benign and malignant. That is, they have a high recurrence rate. If removed, they can again recur, right? They can reappear. And very rarely they can also metastasize as well, but the metastatic potential is very low. So that's why they are called as intermediate, right? So in this category, there are various forms of hemangioendotheliomas and Kaposi sarcoma. Kaposi sarcoma, you know, it's generally occurs in AIDS patients, and it is herpes simplex virus 8 driven disease. Then malignant vascular tumor is angiosarcoma, right? Sarcoma means is a malignant mesenchymal tumor. Angio means it is blood forming. So angiosarcoma is the malignant vascular tumor. Okay, so we start with the vascular ectasias. As I told you, vascular ectasias are not true neoplasms. They are just ectasias. That is, these are just dilated uh, venules or capillaries or vessels, dilated vessels beneath the skin. And obviously, because the vessel is dilated, it imparts a red color to it, right? So it is reddish color lesion which sometimes blanches on pressure. If you appear pressure with finger on it, then it will the redness will disappear, and when you remove your finger again, the redness appears after a few seconds, right? Because these are the dilated blood vessels filled with blood, right? So telangiectasias. For example, nevus planius, commonly called as birthmark, right? So it is again a flat reddish lesion, right, on the face of the infant, and histologically it is composed of just dilated vascular channels, right? So it's not a true neoplasm. It's just a vascular ectasia. Another similar vascular ectasia is spider angioma. And these the name spider is because they have leg-like processes because these vessels have branches, spider formation, right? They typically occur in cirrhosis patients, right, and other hyperestrogenic conditions, right. So they are typical features of cirrhosis. On the chest, the spider angiomas are present in patients with chronic liver disease. In other hyperestrogenic conditions, if there is a tumor, estrogen secreting tumor, then again this can occur, right? So here you can see on the skin these reddish region with spider-like processes, right? And histologically these are just dilated vascular channels, right? Okay, Osler-Weber-Rindor disease. This is again vascular ectasia, right? And here these dilated vasculature, this is because an autosomal dominant disorder, and these vascular ectasias appear uh, in many organ systems. For example, skin, oral mucosal membrane, GI tract, and it can lead to GI bleed. It can occur in urinary tract, and therefore it can lead to hematuria. So hematuria, rectal bleeding, and ectasias involving the skin can occur. Sometimes they occur in the nose, and it leads to apoptosis and so on. Right. So remember hereditary. So remember this Osler-Weber-Rindorf disease. Right. Hereditary hemorrhagic telangiectasia. Okay, now another vascular lesion, which is again reactive vascular proliferation rather than a true neoplasm, like vascular ectasia, is bacillary angiomatosis, right? Bacillary angiomatosis is a unique lesion as it is not, it is basically an infection, right? And it typically occurs in AIDS patients, in HIV positive patient by organism of Bartonella family, right? And it may occur in skin, lymph nodes, or even in brain and bone and other organs, right? So it occurs in immunocompromised patients, right? Immunocompetent patients do not usually get this infection, right? So it's occurs in AIDS patients, and it is caused by a gram-negative bacillus of Bartonella family, generally Bartonella hemiphilae. Okay, why we have included it in vascular lesions? Because there is vascular proliferation, is endothelial proliferation, as you can see, dilated vascular channels, and there are inflammatory cells, and then the colonies of organisms. And you can do a silver stain to highlight these organisms. Okay, so now we have done the non-neoplastic vascular lesions, that is telangiectasias, in which we did nevus splenius, Osler-Weber disease, right? And then we did vascular enteroviruses, which is also a reactive vascular proliferation. Now we come to the benign vascular tumors, right? So in benign vascular tumors, as I told you, hemangiomas, right? And hemangiomas can be capillary hemangiomas, and it can be cavernous hemangiomas, right? They usually occurs in the superficial soft tissue or in the subcutaneous tissue or in the skin. So skin and soft tissue are the typical sites, but they can also occur in the mucosa as well. So skin, soft tissue, and mucosa. So here you can see this is a pyogenic granuloma. Here again, this is a pyogenic granuloma. You can see this is a vascular lesion. So, so here you can see this is a capillary hemangioma, right? Because the lesion is entirely composed of capillaries, right? And this is a cavernous hemangioma in which the lesion is composed of cavernous channels, right? Okay. So lymphangioma, like hemangioma, again it can be simple or capillary lymphangioma or a cavernous lymphangioma, right? So the difference is that in simple capillary lymphangioma, the vessel size and caliber is of capillary size, right? And in cavernous lymphangioma, they are large, big, dilated vessels. What is the difference between a capillary lymphangioma and a capillary hemangioma? Capillary hemangioma will have blood inside the vascular channel, whereas in lymphangioma, there is no blood, right? There is lymph inside the vascular channel, right? Uh, Cavernous lymphangioma, as I told you, that it is composed of dilated, large caliber lymphatic channels, right? So there will be no blood inside the vessel lumen, right? And secondly, in the stroma, there are lymphoid aggregates, which is a very soft sign of detecting this lesion. There is dilated vascular channels along with lymphoid aggregates in the stroma, which is it is a cavernous lymphangioma, also called as cystic hygroma. It typically occurs in children in the neck region, right? And they also occur in vitreoperitoneum of the adult, right? The vitreoperitoneum of adults and children neck region of the children, right? The cystic hygroma or cavernous lymphangioma, right? So we did the benign vascular tumors, and simple classification is hemangioma versus lymphangioma. Hemangioma, capillary hemangioma and cavernous hemangioma, and lymphangioma, capillary lymphangioma and cavernous lymphangioma. Right? Glomus tumor, as I told you, is a perivascular tumor. That is, these are the tumor is not composed of endothelial cells. Basically, in the nail bed area, there are certain modified smooth muscle cells, right? These modified smooth muscle cells are called as glomus cells. They help in thermoregulation, and the tumor arises from these cells is called as glomus tumor. So they typically occurs in the nail bed area, right? And they are very painful, and the treatment is excision. So here you can see in the nail bed area there is a tumor, right? And it is composed of these sheets of epithelioid cells, and they intersperse these dilated vascular channels, right? So the histology is very different from the capillary hemangioma, as we have seen that these are the sheets of epithelioid cells, right? Okay, now intermediate category tumors. And as I told you, the intermediate category tumors, we have two tumors. One is Kaposi sarcoma, right? And the second tumor is epithelioid hemangioendothelioma, right? So Kaposi sarcoma is typically occurs in AIDS patients, right? And there are variants, that is, it can occur in transplant associated patients. It is an endemic variant in Africa, where the disease is endemic, right, and it is not age associated. Sometimes in transplant patients, the other immunocompromised patients, this Kaposi sarcoma can occur, and then there is a classic variant, right? So there are four variants: classic, endemic, transplant associated, and age associated. And the most common one is age associated, right? And it is caused by pathogenesis involves a virus, which is basically an herpes simplex virus AIDS, right? So it is caused by herpes simplex virus AIDS, right? Okay, so almost all cases are associated with herpes simplex virus AIDS and typically occurs in the skin. And clinically, there initially they are patches, that is, they are red patches on the skin. Then these patches convert into raised plaques, right? And then they convert into nodules, right? So there is a characteristic clinical transformation of the lesion from patches to plaques to nodules, right? In Kaposi sarcoma. So here you can see there is ill-defined bluish, blackish, or sometimes reddish lesions on the skin. Very ill-defined. You can cannot figure out where the lesion is started and where the lesion is ending because it is an intermediate category lesion. And histologically, it is composed of sheets of a spindle-shaped cells with extravasation of RBC, right? Sheets of a spindle-shaped cells. And it could be positive with vascular markers CD31, CD34, and it would be positive with herpes simplex virus 8 antigen, right? So to reliably diagnose this condition, you need to sustain herpes simplex virus 8. So regarding Kaposi sarcoma, remember that it occurs in immunocompromised patients. There is an endemic variant in Africa, and it occurs in AIDS patients. It is caused by herpes simplex virus 8. They are clinically the lesions progress from patches to plaques to nodules, right? And grossly they are ill-defined, hemorrhagic, blackish colored or bluish colored, depending upon the stage of the lesion, or reddish colored lesions, right? And microscopically, they are composed of sheets of spindle-shaped cells with extravasation of RBC. Now we are left with the malignant tumors. In malignant tumor, the most common malignant tumor is angiosarcoma. There is also a variant of hemangioendothelioma called as epithelioid hemangioendothelioma, which is also malignant, right? So basically, epithelioid hemangioendotheliomas are rare, so I didn't go into the detail of hemangioendotheliomas. I just touched on the name. But there are various types of hemangioendotheliomas, like capiciform hemangioendothelioma, retiform hemangioendothelioma, composite hemangioendothelioma, etc. All these are intermediate category tumors. There is one hemangioendothelioma which is epithelioid hemangioendothelioma, which is malignant, right? But the most common malignant tumor of the blood vessel, vascular malignant tumor, is angiosarcoma, right? It can be well differentiated, it can be poorly differentiated. Poorly differentiated is very difficult to diagnose, right? And it occurs in skin, soft tissue, liver, breast after radiation therapy. Radiation therapy is the most common risk factor for angiosarcoma. So after radiation therapy, after 10 years or 15 years of radiation therapy, if sarcoma appears, it can be an angiosarcoma, right? So as I told you, radiation is an important risk factor for angiosarcoma, and another risk factor is lymphedema. For example, if the patient has a breast surgery, and which involves axillary dissection. So after breast surgery, axillary dissection, what happens, because the surgeon has removed all the lymph nodes and lymphatic channels. So what happens sometimes, edema is developed in the arm. So if there is chronic edema, then in the setting of chronic edema, this angiosarcoma can develop. This is uh, reminiscent of like Marjolin ulcer, for example, with the long-standing ulcers, so cancer, stomach carcinoma can develop in ulcers and sinus tracts. Similarly, if there is a long-standing lymphedema, then these angiosarcoma can develop, right? So remember the two settings, radiation and then lymphedema. Then there are various, carcinogen exposures that can lead to angiosarcoma formation. For example, polyvinyl chloride, which is used in the plastic industry. So workers of the plastic industry, they can develop angiosarcoma, and that is due to polyvinyl chloride. Then there is a radio contrast agent, which is called as chorotrast, which can cause angiosarcoma. And finally, arsenic can cause, which is in the pesticide strain. So farmers can develop angiosarcoma secondary to arsenic exposure. So remember the carcinogens, that is arsenic, the radio contrast agent, chorotrast, polyvinyl chloride. and especially liver angiosarcomas develop due to the exposure of carcinogens. Then the setting of lymphedema, and the typical clinical scenario would be a woman who had breast cancer surgery involving the axillary dissection. There is a chronic lymphedema, and now irregular reddish, brown, blackish patches are being developed um, on the sites in the axilla, for example, or in the breast. Then it can be angiosarcoma. And then another clinical scenario would be a patient has a history of cancer or lymphoma for which radiation was given, and then 2 years after radiation, completion of radiation therapy, maybe 10 years, because it takes time to develop sarcoma. So that is another clinical context of angiosarcomas. So here you can see this is an angiosarcoma, and the rule of thumb I told you in the beginning that here you see their vascular channels where they are very ill-defined. You cannot readily make out the vascular channels. They are, and this is immunohistochemistry for CD31. It is highlighting the vascular channels, but again you can see all these vascular channels are interconnected. This channel is connected with this, and this channel is connected with this. So all these interconnected vascular channels, and then the cells have atypia, mitosis, and then there is multi-layering of endothelial cells. So these are all features of malignancy, that is angiosarcoma. Here again you can see this is a vascular channel, but here the cells are very atypical. So this is an epithelioid angiosarcoma, highly malignant tumor, fully differentiated angiosarcoma, right? So this is angiosarcoma. So just a quick recap what we did today. So we did vascular tumors and vascular malformations both. We did the classification, and in the classification I told you that there are vascular malformations, then there are benign vascular tumors, intermediate vascular tumors, and malignant vascular tumors, right? Benign vascular tumors include hemangioma and lymphangioma, and hemangioma and lymphangioma can be capillary or cavernous. I go to the picture here. So, the vascular tumors, benign vascular tumor, you can see very well circumscribed small raised lesion, which is reddish in color. So, this is a typical gross picture of benign vascular tumor. So capillary will form the small capillary size blood vessels, and again you can see there is no interconnection. All these capillary size blood vessels are separate from each other, right? And this is a cavernous hemangioma in which you can see there is very dilated vascular channel, right? The difference between cavernous hemangioma and cavernous lymphangioma would be the absence of blood. Here you can see there is a blood cells inside the channel, but there is no blood, and in the interstitium they are lymphoid aggregate. It means that this is a lymphangioma, right? So benign vascular tumors, hemangioma, lymphangioma, capillary cavernous, right? Then perivascular tumor, as I told you, perivascular tumor is a glomus tumor. Glomus tumor is a tumor of perivascular smooth muscle cells, typically occurs in the finger nail beds, very painful, right? And histologically, it is composed of sheets of epithelioid cells, right? And this is positive with asthma immunity, smooth muscle activity, right? Because these are smooth muscle cells, not endothelial cells. It is negative with CD31, CD34, and it is positive with uh, asthma or smooth muscle activity, right? Then we did vascular malformations, and vascular malformations and reactive conditions we discussed vascular ectasia nevus planius, which is a birthmark, and there is a large reddish area over the face of the newborn infant, and histologically it is composed of this dilated vascular channel. Spider hemangioma, they occur in cirrhosis or hyperestrogenic conditions, typically occurs on chests of cirrhotic patients, and there is spider-like dilated vascular channels, right? And then Osler-Weber-Rendorf disease is an autosomal dominant condition. So here the vascular ectasia occur in various organ systems, including nosebleeds, GI bleed, hematuria, hemoptysis, etc. Bacillary angiomatosis is a reactive vascular proliferation. It is caused by Bartonella hemophilae, and you can see vascular proliferation along with inflammatory cells, along with bacterial organisms. And stain would be a Watson silver stain, right? Then among the intermediate category tumor, we did Kaposi sarcoma. Kaposi sarcoma occurs in AIDS patient, but there is also endemic transplant associated in classic Kaposi sarcoma as well, right? Clinically, they are patches that convert into plaques that convert into nodules, right? Very important thing to remember that it is associated with human herpes simplex virus case, right? Here you can see these are plaques of reddish, hemorrhagic, blackish, bluish colored lesions, and microscopically it is composed of sheets of spindle-shaped cells with exfoliated RBCs, right? Among malignant vascular tumors, we have angiosarcoma, and the risk factors for angiosarcoma include these carcinogens like arsenic, chlorotrast, polyvinyl chloride, and typically occurs in these carcinogen associated angiosarcoma in the liver. Then angiosarcoma occur in two other settings, in radiation settings. If any for any lymphoma, radiation was given, and then it also occurs in the setting of chronic lymph edema, right? So remember these three settings for angiosarcoma, right? Histologically, angiosarcoma is composed of poorly formed vascular interconnected vascular channels with endothelial cells showing epithelium, right? So it would be positive with vascular markers like CD31 and CD34, right? Endothelioma, as I told you, most are intermediate category, but one hemangioendothelioma, that is epithelioid hemangioendothelioma, is malignant, right? They are very rare, so I didn't go into the detail of histology of that tumor. Just remember the name and the category. And the take-home message is that in vascular tumors, there is an additional category apart from benign and malignant, and that additional category is intermediate. And there's a very important tumor that comes under the category of intermediate, and that is Kaposi sarcoma. Okay, so we conclude here. If there is